Hello, thank you very much for the opportunity today to share with you two initiatives that will be implemented at the Grand Canyon University Primary Care Clinic, Precision Medicine and AI. My name is Elizabeth Lafortune and it is my pleasure to speak with you. In this presentation, I will provide an overview of precision medicine. I will discuss data collection protocols, data security and privacy, patient selection, and treatment plan development. Then I will go over physician and staff training, remote patient monitoring, outcome assessment, and feedback integration. To conclude, I will touch on public awareness and education. Personalized medicine refers to the tailoring of medical treatment to the individual characteristics of each patient. It involves using information about a person's genes, environment, and lifestyle to make informed decisions about their medical care. Personalized medicine aims to provide more customized health care to the individual patient. However, personalized information may not always lead to improved health outcomes. However, precision medicine is a more specific and targeted approach that uses large data sets such as genomic information and electronic health records to guide medical decisions. The goal of precision medicine is to provide a more precise and evidence-based approach to disease prevention, diagnosis, and treatment. Precision medicine leverages advances in areas like genomics, data analytics, and population health to tailor healthcare to unique patient characteristics. Precision medicine approaches may lead to non-personalized interventions that can be applied more broadly to a population. The primary objectives of this data collection protocol is to gather comprehensive patient data, including medical histories, genetic information, and diagnostic reports to enable the development of personalized treatment plans. We will collect detailed medical history from each patient, including past and current medical conditions, hospitalizations, surgeries, medications, allergies, and family medical history. This data will be collected through patient interviews and the review of EHRs. Data will be entered in a standardized case report form to ensure consistency. We will obtain consent to collect genetic samples for genomic analysis. We will send samples to a certified lab for whole genome sequencing or targeted genetic testing, depending on the patient's condition. We will record all genetic test results, including identified genetic variants in the patient's CRF. We will collect all relevant diagnostic reports, such as lab test results, imaging studies, and pathology reports, etc. These reports will be obtained from the patient's medical records and uploaded to the secure study database. Key points from the reports will be abstracted and entered in the CRF. All patient data will be stored in a secure HIPAA-compliant database accessible only to authorized study personnel. Each patient will be assigned a unique study ID to protect their identity. Regular data quality checks will be formed to ensure accuracy and completeness of the data of the collected information. Data will be backed up regularly and stored in a secure off-site location. Patients will be required to provide information consent prior to participation in the study. The study protocol and consent forms will be reviewed and approved by a review board. Strict data privacy and security measures will be implemented to protect patient confidentiality. Patients will have the right to withdraw from the study at any time without penalty. HIPAA establishes a robust framework of security and privacy and accountability measures to protect the confidentiality and integrity of the patient data within the healthcare industry. HIPAA mandates data security controls, including administrative policies, physical protections, and technical safeguards to protect the integrity and confidentiality of patient data. HIPAA enhances patient autonomy by ensuring timely access to medical records and the ability to request amendments. However, it also imposes strict access controls to restrict patient information access to only authorized personnel. HIPAA also requires covered entities to notify patients and regulatory authorities in the event of a data breach involving PHI. This ensures transparency and accountability in the handling of sensitive patient data. HIPAA also holds healthcare organizations to high standards of patient data protection with significant fines for non-compliance. Healthcare organizations must continually assess risks, develop comprehensive policies and procedures, train staff, and monitor access controls to maintain HIPAA compliance. Understanding the genetic and molecular factors underlying depression, anxiety, and schizophrenia, healthcare providers can develop highly customized treatment plans that are more effective and better aligned with the individual's unique needs and circumstances instead of a one-size-fits-all approach. The treatment plan should be developed collaboratively between patients and providers with a focus on identifying the patient's personal health goals and priorities. Personalized plans should consider non-medical factors like a patient's social determinants of health, relationships, spirituality, and lifestyle habits, in addition to their clinical needs. The treatment plan should facilitate coordination of care amongst different providers and settings to ensure continuity and alignment of the patient's care. This personalized approach holds great promise for improving outcomes, greater patient engagement, and more efficient use of healthcare resources. The team will collect and analyze extensive patient data, including EHRs, genetic information, lifestyle factors, and environmental exposures. AI algorithms will be used to process this large and complex data set, identifying patient patterns, trends, and correlations that may not be apparent to human clinicians. The AI models can predict individual treatment responses, drug interactions, and potential adverse events based on the patient's unique characteristics. This data-driven analysis will enable the team to develop highly customized treatment plans tailored to the patient's specific needs and circumstances. Genetic testing and genomic profiling of the patients will be a key component of the personalized treatment plan development. By understanding the patient's genetic makeup and relevant genetic variants or mutations, the team can identify targeted therapies or interventions that are more likely to be effective. The genetic data can also help predict how the patient may respond to certain medications, allowing the team to optimize drug selection and dosing. Integrating genetic insights with the broader patient data will provide a more comprehensive understanding to guide the personalized treatment plan. The treatment plan will be a collaborative process involving the patients, clinicians, and any other relevant healthcare providers. Providers will be educated on interpreting genetic and genomic test results, understanding how genetic factors influence disease, risk, and drug response, and applying this knowledge to personalized treatment plans. Providers will be trained on how to leverage AI algorithms and data analytics to process complex patient data, identify patterns, and generate personalized insights to guide clinical decision making. Providers will be taught how to collaboratively develop personalized treatment plans with patients, incorporating their unique clinical, genetic, and lifestyle factors. They will provide a solid grounding in the core principles, concepts, and applications of precision medicine, including its potential to improve outcomes and challenges to implementation. Training will encourage collaboration between providers from different specialties to leverage their expertise. Ongoing training will be established, and professional development opportunities will ensure providers stay up to date with the rapidly evolving field of precision medicine. Training will be offered in various formats to best fit the needs of the individual. Online courses and webinars provide flexible, self-paced training. In-person workshops facilitate interactive learning, and job shadow opportunities support practical applications of skills. The healthcare team will implement a real-time patient monitoring system to capture feedback from patients throughout their care journey. This allows the team to flag poor patient examples in real time and review data through dashboards. By embedding patient feedback into the existing EHR, the team can make it easier for patients to provide input and ensure the patient experience is captured. The team will utilize remote monitoring tools such as fitness trackers to collect real-time data on patient vital signs, physical activity, and other healthcare indicators. This real-time data can help the team quickly identify changes in a patient's condition and prioritize accordingly, improving patient outcomes. By continuously monitoring real-time patient data and feedback, the team can identify opportunities to adjust the patient's treatment plan and optimize their care. This could involve monitoring medication dosages, the frequency of follow-up appointments, or implementing new interventions based on the evolving needs and preferences. Implementing validated PROMs that capture the patient's perspective on their health status, symptoms, and quality of life. We will collect PROM data at baseline and throughout the pilot implementation to track changes in patient-reported outcomes. We will utilize ClinRose, where healthcare providers observe and report on patients' conditions, to supplement the patient-reported data. ClinRose will provide an objective assessment of the patient's physical and cognitive performance, which can be compared to historical data. We will identify key clinical outcome measures such as mortality rates, hospital readmissions, and adverse events that are relevant to the patient population and the treatment strategies implemented. We will compare the clinical outcomes observed during the pilot to historical data to evaluate the effectiveness of the new treatment approach. We also will collect data on the costs associated with the new treatment strategies, including direct medical costs, indirect costs, and the cost savings realized. We will compare the cost effectiveness of the new approach to historical data or benchmarks to determine the overall value proposition. Patients appreciate the ability to provide real-time feedback on their care experience as it makes them feel heard and valued. Patients find the feedback mechanisms such as surveys and assessments easy to use and navigate. Patients value the flexibility to provide feedback through apps, online portals, and in person. Patient feedback should not add significant time or burden to their care experience. Medical staff appreciate the ability to quickly identify and address poor patient experiences in real time, allowing them to intervene and improve the care delivery. Staff appreciate the intuitive dashboards and reporting tools that make it easy to analyze and act on the patient feedback data. Staff feel empowered to make data-driven decisions and implement targeted improvements based on the patient feedback received. Our objectives are to increase public awareness and understanding of precision medicine and IA applications in healthcare. We aim to dispel common misconceptions about the use of these technologies and their impact on patient care. We want to encourage patient engagement and participation in precision medicine and AI-enabled healthcare interventions. Our target audiences are patients and their families, healthcare consumers, community organizations and advocacy groups, and local healthcare providers and professionals. Our informational seminars, we will try to host a series of seminars at community centers, libraries, and other public venues to provide an overview of precision medicine and AI. We will organize hands-on workshops that allow participants to engage with AI-powered healthcare tools and technologies. We will host panel discussions and roundtable events featuring patients who have benefited from precision medicine and AI-enabled care. We will collaborate with local healthcare providers, community organizations, and patient advocacy groups to promote the educational events and encourage participation. We will collect feedback from patients after each event. We will collect feedback from participants after each event to assess the effectiveness of their educational content and identify areas of improvements. Finally, this is my reference page. These references support the information presented in this PowerPoint. Thank you very much for listening to these two very exciting initiatives. I appreciate your time and welcome any questions you may have.